Welcome to Chat About with Rosalee Henry.
Hi everyone, this is Rosalee and welcome back to Chat About with Rosalee Henry. Today we are going to be talking about patient care and recovery, and I have with me the lovely Dr. David Whiteman, who is a surgeon here in Atlanta. Dr. Whiteman, thank you so much for being here.
Oh, very kind. I'm glad to be here.
Thank you. Dr. Whiteman, you have been a surgeon now over 30 years.
Yeah.
Helping patients here in Atlanta. You have a great reputation. I've worked with you, I've used your service, I've referred your service so many times. What keeps you going?
Well, I'm a plastic surgeon, and what's great about being a plastic surgeon is that every day your job's a little bit different. So if people come in for a tummy tuck, it's not the same for everybody. And the other important thing about that is when people put their trust in you, you got to give it your all from beginning to end. And that's kind of what keeps me going.
Great. One of the things that I've heard your patients say about you, because we have collaborated on so many levels, is that you put so much into caring for them, not just the physical care, but the mental care. You care about how they feel. You care about their identity, and that is so important. So it's not just the procedure. You go beyond. What makes you do that?
Well, I kind of tell the girls in my office that people come in and they trust you. And when they give that trust to you, you have an obligation, to return that type of energy back to them. And it makes the job so much more fun. You learn about the patient, you learn about their family, and they really kind of emotionally open themselves up to you. So you have to be ready to receive that and then kind of return it in a way that's productive and helpful to their recovery.
Yes, that is so important. I know for a fact that a lot of clients, I've worked with you where clients come all the way from California.
Yes.
Just to have you help them. And it's not because of what they read on social media, but even the conversation that they have with you before they even book the service. And a lot of time as healthcare professionals, you don't get that. It is just another patient, it's just another procedure. And I really love that about you. Like I said, I talk so much about you, I've worked with so much of your clients, and you put so much into what you do.
Thank you.
Social media right now, it can be good and can be so bad.
Right.
And a lot of times, people are thinking that what they see on social media is the real thing. How do you help them to navigate that and be realistic in what is going on?
That's a great question. The first thing we say is turn off your phone and listen. Come in and listen to our conversation. We have information for you. We can give it to you verbally. In our office now, we have a system where patients can dial in to their own chart and read about things like recovery. But the hardest thing is to undo what they read on the internet, because it's amazing how much trust people put into these anonymous posts. And yet, when they sit with you, a professional, they're kind of a little bit skeptical about what you have to say. We have people that come in and say, do you do this operation like the person on Instagram? And I'm like, probably not. And I don't learn my operations on Instagram.
You're board certified surgeon,
right.
not an
Yes.
Instagram surgeon.
Very well put. I'm gonna use that.
Yes, I'll send you the bill for that one.
Okay.
Okay, so I like the way you said the realistic part of it. And surgery doesn't stop at, the recovery doesn't stop at the surgery.
No.
It goes beyond that. And like I said, I've worked with so much of your clients. And one of the things I love with you also is that you are readily available. So even when we are helping one of your patients, we can always reach out to you and say, Dr. Whiteman, these are the things that we're seeing. And that person, like you said, they can even dial in to their portal and they have a system right there. And that is so important.
Yeah. I mean, we will get a phone call from you, one of your employees, reporting on a patient. They can recover in their own homes. You can go visit them.
Our place of recovery could be a hotel. We've gone to hotels before.
Exactly. It is a very important thing because the industry that you're in, there's not a lot of screening. There are a lot of people who think they can do what you do. And I think that when you're selecting your recovery, be it with their family, with a nurse, they also have to be fully aware that they are receiving quality information and quality care. And for us being available, it's super, super important.
That is so important. And that we're going to take a break. And when we come back, we're going to talk about what goes on beyond the procedure. Because like we said, it doesn't stop at the surgery. You have the recovery part of it, where it's not just the physical part, it's the mental part,
very
the
important.
Emotional part. So please stick around, come back. We will be right back where we have Dr. David Whiteman. We will be talking about patient care and recovery. Hi, I'm Rosalee Henry, the seven-figure doula whisperer and founder of Mothers Helping Hands Atlanta. If you're a doula trainer, educator, or program director, I want to talk to you about something that's been missing from our industry for far too long. A real pathway to help doulas build sustainable businesses that last. So many amazing birth workers enter this field full of heart and purpose, but within a year or two, many are burnt out, underpaid, or forced to step away. And when that happens, we lose more than a business. We lose access. We lose representation. We lose another chance to make an impact in the fight against maternal mortality. That's why I created the Modern Mom Toolkit Business in a Box plus GPT, your AI growth partner, a complete, ready to launch system designed to help doulas build a sustainable, thriving career. It includes everything they need to start and scale: client templates, marketing tools, business system, and now AI automated to help them manage operations and prevent burnt out. When doulas have the structure, system, and support, they stay in this work longer, and that continuity saves lives. I'm now partnering with doula trainers and educational organizations who want to give their students more than just a certification. They want to give them stability, confidence, and a model for long-term impact. By collaborating, you'll empower your graduates to build real businesses while helping reduce burnout and strengthen maternal care in every community. If you're ready to expand your impact, to be part of the solution, I'd love to connect with you. Click the link in this post or send me a message and let's talk about how we can work together to empower doulas, prevent burnt out, and make a real difference in the maternal health. I look forward to talking with you.
Welcome to Chat About with Rosalee Henry.
Welcome back so we can continue this conversation with Dr. Whiteman. Dr. Whiteman, as someone who has served in leadership role, what would you like to see in healthcare when it comes to educating the clients?
Well, I think doctors and doctors' offices do spend time with things like consent forms, they're pretty good at preparing patients for their procedures, but there's not a lot of motivation to spend a lot of time on educating for after the operation. So the important thing is to be able to provide patients with a resource, a reliable education program, and it should come from the doctor's office, because it's no one-size-fits-all form of recovery. We have an issue with patients who, I happen to operate on a lot of women. These are powerful women who do busy jobs as being a mom, and they work, and sometimes they struggle with recovery because they don't realize that they're going to be kind of knocked down a little bit. And I always joke with them. I said, there's no A in recovery. I said, you're probably an A student, but there's no A in recovery. So give yourself a chance. It's okay.
I like that. There's no A in recovery. Education is so important, because if someone knows exactly what to expect after surgery, it's like a storm. I always use the analogy of a storm is coming. If you know a storm is coming, you're going to prepare. You're going to have your water. You're going to have your batteries. You're going to have your flashlight. So if that storm does hit, you're prepared. But if you have no idea that it's coming, you're not going to be prepared. So plan ahead what your support team is going to look like. Like you said, education is key. What are they being told? How are they being prepared for what's coming next? You also touch on the educated woman, the professional woman, and a lot of times, because we as women, myself, we already have everything all figured out, but this is new territory.
Exactly.
And this is not something that you're always, even you might watch it on YouTube, you might watch it on Instagram, but it's different when you're going through it. And that a lot of time is where the mental part of it come in.
Yeah,
Depression.
self-doubt.
Self-doubt.
A lot of tears sometimes, and we tell them, we always joke, we have about one crier a month, and they're not crying because they're sad. They're crying because they don't understand why they feel the way they do. And we generally tell them, it's very normal. You're used to success and maintaining the house and working, and this is something that you can't control. So one of the things about going into recovery is realize that you're on a bit of a conveyor belt. You don't have the control exactly over what's happening. Having helpful family members is useful. I also joke, most men have about 2 days of sympathy in them, and after that, they're done. So use your sympathy wisely on your husband, but otherwise, get going, and if you have questions, don't ask your family member, call the office.
Yes, reach out to the professional.
Yeah,
yes.
We'll tell you, that's normal or it's not normal.
Yes, you said something about control. And sometimes for us as leaders, it is so hard to give up control. I'll be working with a mom who has just given birth, and maybe days later, sometimes it's a C-section, sometimes it's not. And she may look at her body, and she, like you said, criers, she may start crying because she no longer recognizes her body. And as part of her support team, we now have to encourage her, validate her feeling, because what she's seen is real, but also be there for her to support her.
I'll give you a little trick that I kind of learned over the years. When we have patients who say they're worried or scared, we want to hone down on that. It's what are you scared about specifically? Now, if they're scared out here in this orbit, that's not helpful.
Right.
But if they're scared like, I'm scared about having an anesthetic. Okay, we talk about that. I'm scared about the pain. Okay, we talk about that. And once you are able to get them across that bridge, they're usually fine. And many of these people, while they're anxious going in, afterwards, they're good.
Yes. How do you navigate when someone comes in with this unrealistic expectation? They've seen these people on social media, and now they want to have the same body, or sometimes it's AI, sometimes it's not even real.
Right.
And they're competing with these images. How do you get them to realize and to have realistic
Sure.
expectations?
Well, we confront that directly. I actually do keep some pictures in my office of what people have brought in, and clearly, I will say, nobody has a waist that looks like that and a butt that goes with it, okay? You know that. And they usually laugh.
Yes.
Or I think if we can break down that idea of, seriously, do you really think that that is a real outcome? And I think they like the idea that we're realistic about it. And by the way, if we can't get through that barrier, we don't do the procedures, because it's a no-win situation for us.
Yeah. Because you won't be able to get through to them, and then that's also going to ruin your
That's the
reputation.
same patient who, when she has a good result, she can't see it.
Yes. So is that the reason why a lot of people keep going and going and going, because they're just not satisfied with where they are, and then it now affects
You know,
their
we
mental
do
state?
know about things like body dysmorphia. These are people who truly have a mental illness. Those are things you want to pick up before and help them with therapy
Yes.
before they get
Yes,
involved.
yes.
Yeah, you want to stop that
Yes.
before you get there.
Well, we are going to take a break on that, and when we come back, we're going to continue this information sharing, and just making sure that patients have the education and information they need, so they can make the informed decision that's needed, because sometimes surgery is needed.
Yeah, for sure.
So please stick around. We're going to be right back to continue this conversation.
After a successful inpatient procedure, a prominent star from TLC's 1,000-pound Best Friends begins her journey to recovery with personalized care from Mother's Helping Hands Home Care. Trusted and recommended by her doctor, we're here to ensure a smooth and comfortable transition home. Featured prominently on TLC, Mother's Helping Hands Home Care is your trusted partner for professional care.
Thank you for watching Chat About with Rosalee Henry.
Welcome back to Chat About with Dr. Whiteman. So Dr. Whiteman, what I'm hearing is that this isn't just about the procedure, it's also about the recovery and the importance of having the support that's needed to help with the mental part of it, not just the physical part of it. So when someone comes in to you for surgery and they're telling you that I'm going to be doing this major surgery, but I have no support at home. I am going to be taking care of myself. They have all these realistic expectation that this is only going to take a couple of days, and then I have to go back to work because I only have this amount of time off. How do you help them to see the
See the light.
See the light.
Well, the reality is that everybody needs help at home. Right from day one, nobody goes home from the hospital alone, and nobody should be at home alone for the first 24 hours after anesthesia.
Yes.
Okay? Secondly, you've got to realize that this recovery is going to be staged. Well, I tell patients, the first day you're going to feel you got hit by a truck, but still get up and move around.
Yeah.
And then the next day, a little bit more and a little bit more. Our C-section patients who had a previous C-section, they kind of get it, because after they've had a C-section, they've been told, get out of bed and get going. So the reality is that as long as we can tell them and control their anxiety, they'll be able to follow the instructions. But having somebody who is educated and says, yes, I've seen this before, you're doing okay, that goes a long way.
Just having that reassurance, someone to help you. You touch on the C-section. As a postpartum doula, I've cared for so many women who has gotten C-section. Some are planned C-section and some are not. And during my intake, I always ask mom, what is your plan in case you have a C-section? And some may be, I'm not a candidate, I'm gonna have vaginal birth, and always do your research. Because if you do get a C-section, your support team is gonna be different from if you have a vaginal birth.
Yeah.
So I'm glad you touched on the C-section part of it. Also, I've cared for some of your clients who have mommy makeover.
Yes.
And I have to tell them, it is different from having a C-section.
Yes.
It's different because now when you have a C-section, sometimes it's your first child, and you're told that you're not supposed to pick up anything heavier than your baby. Now the baby may be 3 or 4 years old, and you're now doing a mommy makeover. That baby is no longer a baby.
So we actually have that discussion because we tell people you need a responsible adult at home.
Yes.
Not just an adult, but a responsible adult. And we usually joke that they come in with their husband or something, and we say to them, are you responsible? And if they're not, a lot of our ladies will know whether their husbands are good or whether they're going to be problematic.
Oh, Lordy.
And then they'll take care of it. But I always reassure them that we're here. And the nice thing about cell phones actually is that people can take pictures and they can communicate, and we can do home calls. Yes. So while some technology is problematic,
some is helpful.
Some is helpful.
Yes. So that is a good point to touch on. And like you said, you have a portal, so they can even send in those questionable photos to you, and you could look at them and you could give your feedback.
Yeah, very helpful.
You and I have collaborated over the years. What would you say to other provider like yourself, the importance of collaborating with other professionals in the community that is going to help the patient to have a better recovery? Because we cannot operate in silos. It's not just your patient. There are others out there that are in between you and your patient that is going to help to make that recovery better.
Well, what I say is I can control what goes on in my office, and I can control what goes on in the operating room. But after the patient leaves the hospital or the outpatient center or the office, I can't control that. But if I can collaborate with somebody who can provide professional services that we can trust, it allows me to sleep comfortably.
Yes.
And it allows me to relax. Yes. Because when you're taking somebody's, concerns or problems or illnesses and trying to make them better, you can't do it on your own. No. You need a professional to help you. And that recovery phase is as important as the procedures that we do.
So are you saying that you're not going home with the patient?
I have gone home with some patients. Families and friends. Oh my goodness. My wife is a very good cook, so they actually really enjoy themselves. But yes, I do not want to make that a regular.
I can understand that. So Dr. Whiteman, can you tell my audience how can they get in contact with you if they have any concern or they're thinking about getting plastic surgery but they're not sure?
Sure.
What to do? How
well,
can they get in contact
we are Southern Plastic Surgery. We've been in practice for 33 years. Office number 770-622-9100. My staff's been around forever.
Yes.
25, 26 years. Can't get rid of them.
I don't think you want to, though.
No, I'm just joking.
Okay.
And reach out. We'd be happy to talk to you and answer questions. And if you're a candidate for procedures, we'd love to do it for you.
Yes. I love the fact that you take the time to sit and talk with your patient and make sure that they understand what they're getting into.
Yeah.
And that's very important. So if you are having surgery or you know someone is having a surgery, please reach out to Dr. Whiteman, but also think about what is your recovery plan? What does that look like? Because that's something that we can step in and help you with. I've been doing this for over 20 years. Mothers Helping Hands Atlanta, we have worked with Dr. Whiteman. I've helped so much of your patients.
Yes.
And it has been wonderful. Everyone has so much great things to say about you. And again, mental health that part of it is important.
Yeah. We get great feedback from our patients who work with you, and you're our number one recommendation.
Well, thank you. Collaboration is key. We cannot operate in silo and say we care about our patients or our clients. It takes a village, not just for a newborn. It takes a village throughout the different stages of everyone's life. So until next time, this is Rosalee Henry with Chat About, and thank you so much, my audience, for watching, and we will see you on the next episode.
Thank you for watching Chat About with Rosalee Henry.